They'll start in gynecology, and the first topic in gynecology is contraception. We'll discuss some points about contraception and the type of contraception that we should use in different kind of scenarios for Plab1 exam. So before we discuss different type of contraception, we need to understand about UKMEC categories. So what is UKMEC? UKMEC is basically UK medical eligibility criteria for contraceptive use. It offers guidance on which type of contraceptive method can be used safely in different kinds of scenario. So UKMEC means the contraception can be used freely and there is no restriction to use contraception. UKMEC 2 means the benefits outweighs the risk. There are some risk with the use of contraception, but still benefits outweighs the risk. UKMEC 2. UKMEC 1 and UKMEC 2, they are good choices for the exam. So if in the questions both of them are given, then your first choice is UKMEC 1. But if a UKMEC 1 drug is not given in the option, then you can choose a UKMEC 2 contraception as well. Both of them can be used. So they are good choices for the exam. While UKMEC 3 and 4, in UKMEC 3 means risk outweighs the benefits. So the benefit is less and the risks are more. It is UKMEC 3. And UKMEC 4 means unacceptable health risk or absolute contraindication. So UKMEC 3 and UKMEC 4, they are never a good choice for the exam. A good choices for exam is UKMEC 1 or UKMEC 2. So now I'll discuss different scenarios. So the first scenario that we'll encounter is contraception in young patients. Contraception in patients who are less than 20 years old. Under 20 methods of contraception are UKMEC 2 or they are contraindicated. What are those methods of contraception? So we have two types of contraception. One is long-term contraception and one is short-term contraception. The methods of contraception that can be used on short-term basis includes combined oral contraceptive pills and progesterone-only pills, POP and COCP. POP and COCP, they are oral contraceptive and they provide contraception for a shorter duration of time. So if for a short-term contraception, then we'll go with COCP or POP. COCP is combined oral contraceptive pills that contain both estrogen and progesterone. And then there is type of oral contraceptive which only contain progesterone, that is progesterone only pills or POP. There's another method of short-term contraception, and that is in the form of injection of depoxy progesterone acetate or DMPA. So DMPA is also a method of short-term contraception, which is in the form of injection. The injection need to be taken every 3 months. So the methods for short-term contraception include combined oral contraceptive pills, which contain both progesterone and estrogen. Number 2 is progesterone only pills. And number 3 is DMPA injections, which need to be taken every 3 months, while the pills need to be taken daily. So these 3 methods are used when short-term contraception is required and the patient is looking for a short-term contraception. Now, there are 3 methods for long-term contraception. What are the 3 methods that can be used as a long-term contraception method? They include an intrauterine device. Now, the intrauterine device, there are 2 types of intrauterine device. One is IUS and one is IUCD. IUS is also known as Mirena intrauterine system. It is basically a device which releases progesterone slowly into the blood. This device contains a medication such as progesterone, which is released slowly into the blood. And the second device that can be used for a long-term contraception is intrauterine copper device. So IUD can be of 2 types. One is IUS and one is IUCD. So IUS and IUCD, both of them are for long-term contraception. And then there is another drug that is known as Nexplanin. Nexplanin, they are progesterone only implants. They are injected subdermally or intradermally, and they can also be used for long-term contraception because they can provide contraception for 3 years. So for short-term contraception, COCP, POP, and DMPA injection. For long-term contraception, IUD, such as IUS and IUCD, plus progesterone or etonogestrel implant, such as Nexplanin. So 3 methods are for long-term contraception and 3 are for short-term contraception. So whenever you encounter a scenario that is about contraception, first of all, the thing that you need to do is to see if the patient is looking for a short-term contraception or if she is looking for a long-term contraception. Either the family of the patient is complete or incomplete. If the patient's family is complete, then long-term contraception such as IUD are preferred. And if the patient is incomplete or if the patient wants to get pregnant within 6 months or after a period of 6 months, then short-term contraception such as COCP and POP are preferred. Though DMPA or medroxyprogesterone acetate needed to be taken every 3 months, but after injection of DMPA, fertility can take up to 12 months to return after injection of DMPA. So they are not a good option if the patient want to get pregnant within 6 months or after 6 months. Then the only option that we have, if the patient want to get pregnant or looking for a contraception for 6 months only, then the only option we have is COCP or POP. DMPA is not a good option if the patient want to get pregnant after 6 months, because after DMPA injection, though it needed to be taken after 3 months, but the fertility usually return within a year, or it may take up to 1 year for the fertility to return after DMPA injection. So it's not a good option if the patient want to get pregnant within the next 6 months. So these are some points about contraception and their uses. Contraception which can be used for short-term basis, and contraceptive methods which can be used on long-term contraceptive basis. Is it clear to everyone up to this point? Is there any question?
So can you please tell us about DMPA again?
Yeah.
Depoxy,
Yes.
progesterone acetate is an injectable form of progesterone only contraceptive method. It needed to be taken every 3 months. For Plab1 exam, remember that if in the scenario, the scenario is given that the patient want to get pregnant after 6 months and she is looking for a contraceptive method, then the only choice you have is COCP or POP, combined oral contraceptive pills or progesterone only pills. The reason for this is that with DMPA or depoxyprogesterone acetate, the fertility can take up to 1 year to return back. So that's why if the patient want to get pregnant within 6 months or after 6 months and is looking for a short-term contraceptive method, then DMPA is not a good choice.
So DMPA is a long-term contraception. Is it a long-term?
It is included in the short-term category.
Okay.
Short-term, if the patient is looking to get pregnant within a year or after a year. Basically, IUD and IUCD, the problem with them is that they need one appointment for insertion and one appointment for removal. So that's why, because they need 2 appointments, one for insertion and one for removal, and it takes time for the appointments, usually 1 or 2 month appointments. So that's why they are in the long-term category. And they can be used for 5 years or 10 years period of time. But DMPA or these injections, they can be given at any time after a period of 3 months. But the problem with them is that even if the patient does not take the injection after 3 months, the fertility may not return. It will take almost 6 to 12 months for fertility to return back. So that's why if the patient want to get pregnant after 6 months period of time, then DMPA is not a good option. Is it clear, this point?
Yes.
Because with the DMPA, the patient periods are disturbed, or DMPA, you can say they can cause amenorrhea or oligomenorrhea. They can cause menstrual irregularities, and the menstrual cycle gets back to normal within 6 to 12 months after a DMPA injection. That's why they are not a good option for short-term contraception.
Dr. Shah,
now, yes.
Sorry, is Nexplanon UKMEC1 or 2?
Nexplanon for
under 20.
under 20, it's UKMEC1.
Okay.
Now we are going to discuss the contraceptive methods. There are UKMEC categories in a patient who are under 20. Now, DMPA is UKMAC2 in patients who are under 20 or above 45. The reason for them to be UKMAC2, what is UKMAC2? UKMAC2 means there are some risks, but still you can use them if you don't have an option of UKMAC1 category. Remember that DMPA causes osteoporosis. That's why they increases the risk of fracture in patients who are under 20 or who are above 45 years of age. DMPA decreases bone mineral density in patients who are under 20 or above 45. That's why DMPA increases the risk of fracture. So it's UKMAC2 in patient under 20 or above 45. So DMPA is UKMAC2. Now, what about IUD and IUS or IUCD? They are also UKMAC2. So DMPA and yes.
So because of the fractures and decreasing bone density, it is not
Yes,
UKMAC3?
Yes, it is UKMAC2. You can still use it. The risk is not that much. The benefits are still greater in these age period. They can be used, but they are not the favorite or gold standard in this age group. Remember that sometimes in the options, only UKMAC2 drugs and UKMAC3 and 4 drugs will be given. So you can still select UKMAC2 option as your answer if UKMAC1 drug is not given in the option. It's okay to choose UKMAC2 drug because the benefits outweighs the risks if the drug is UKMAC2.
Okay.
So DMPA is UKMAC2 because it increases the risk of fracture in patients who are under 20 and in patients who are above 45. So DMPA is UKMAC2. Now IUD such as IUS and IUCD are also UKMAC2. Why they are UKMAC2? Because in young patients, the cervical os is very small. In young and nulliparous women, the size of the uterus and cervical os is very small, so it is very difficult to insert these devices. So that's why IUD and IUCD, they are UKMAC2 in a patient who are less than 20 years old, because the young and nulliparous patient have a small uterus and their cervical os is closed. Their cervical os is very small. So it's difficult to insert these devices in such patients. That's why IUS and IUCD are also UKMAC2 in young patients. So what are UKMAC1 drugs for patients who are under 20?
Nexplanon only.
Yes, if the young patient is looking for a long-term contraception, then we'll go for Nexplanon, which is etonogestrel implant. Etonogestrel implant usually provide contraception for 3 years, for a period of 3 years. So that's why if a patient who is under 20 years of age and is looking for a long-term contraception, then Nexplanon is a UKMAC1 option. There's no restriction to use Nexplanon if the patient is less than 20 years old, so it's UKMAC1. And if the patient is looking for a short-term contraception, then we will go for COCP, and POP. In a patient who are less than 20 years of age. So in short, DMPA and IUD are UKMAC2, Nexplanon and COCP for oral contraceptive pills are UKMAC1. So for short-term contraception in young patient or less than 20 years old, COCP or POP. And for long-term contraception in patients who are less than 20 years of age, long-term contraception, Nexplanon is a UKMAC1 option. DMPA and IUD, both of them are UKMAC2 in patients who are less than 20 years of age.
So Nexplanon is long-term contraception or short-term?
Nexplanon provide contraception for 3 years. Nexplanon, basically it is a device which contain etinogestrel, and that is implanted in the skin or intradermally in the skin. It releases the etinogestrel slowly, and it can provide contraception for 3 years. So it's a contraceptive method for long-term contraception, Nexplanon.
So what is the period for short-term? Is it like 6 months, few months, or like what is the difference between long-term contraception and short-term in terms of the period?
Yes, you can say that if the patient is looking for contraception for months, then it's short-term contraception. For a period of 6 months or even a year, then you can say that it's a short-term contraception. But if she is looking for a contraception for more than a year, such as 2 years or 3 years or 5 years or 10 years, then we'll go for an option that provide a long-term contraception, such as Nexplanon, which provide contraception for 3 years, and IUD, which can provide contraception for 5 to 10 years. Is this point clear, Dr. Abdullahi?
Yes, doc. Yes, it's clear.
Okay, so we have discussed one scenario in which the patient was young or under 20 years of age. Now, a second scenario, patient who is taking anti-epileptics and she comes to you for a contraception. Then what things that you need to consider before prescribing contraception to a patient who is a non-epileptic and is taking anti-epileptic medications? So remember that 3 anti-epileptic medications which are potent enzyme inducers, such as carbamazepine, phenytoin, and phenobarbital. Carbamazepine, phenytoin, and phenobarbital. If the patient is taking one of these drugs, then remember that these 3 drugs, they are potent enzyme inducers. So they can reduce the efficacy of COCP, POP, and implants such as Nexplanon. Enzyme inducers such as carbamazepine, phenytoin, and phenobarbital, they reduce the efficacy of combined oral contraceptive pill, progesterone only pill, and implants. So if the patient is taking one of these anti-epileptic medications, then you cannot prescribe COCP, POP, or implants. You need to go for other options. So a short scenario of this, the patient are taking enzyme inducers, then oral progesterone only contraceptives, they cannot be used in such kind of patient. neither COCP nor POP because their efficacy is reduced. Also, implants such as Nexplanon, its efficacy is also reduced. The only things or the only contraceptive method that can be used in patients who are taking enzyme inducers such as carbamazepine, phenytoin, and phenobarbital are progestogen only injectables such as depot medoxyprogesterone acetate injections. They are okay to use because the efficacy of injectable contraceptive methods are not reduced if the patient is taking enzyme inducers such as carbamazepine, phenobarbital. Another short summary of choice of contraception in patients who are taking enzyme inducers. So if the patient is taking enzyme inducers, then we will not use COCP, POP, or implants. We are left with two options only. One is intrauterine system or other is Depo-Provera injection. When we will use intrauterine system and when we will use Depo-Provera injection, if the patient is having irregular periods, prolonged or heavy menstrual bleeds, then we will go for intrauterine system, US or Mirena. And if the patient is not having irregular periods or prolonged or heavy menstrual periods, then we will go for Depo-Provera injection. Again, patients who are taking enzyme inducers and the patient age is 18-year-old. Patient is 18-year-old and he is taking enzyme inducer. What option do we have? We cannot use COCP, POP, or implants because their efficacy is reduced if the patient is taking enzyme inducers such as carbamazepine, phenobarbital, and phenytoin. So we are only left with IUS. There are still UKMEC2 in younger patients, IUS and Depo-Provera injection. There's a risk, but they are UKMEC2. So they can be used in patients who are less than 20 years of age. Because UKMEC1 categories such as COCP, POP, and implants, their efficacy is reduced due to enzyme inducers. So we cannot use the UKMEC1 drug in this age group. So we'll go for a UKMEC2 drugs, either IUS or Depo-Provera. Which one, that depends on the clinical scenario. If the patient is having prolonged heavy menstrual periods, then we will go for IUS. And if the patient is not having any heavy menstrual bleed, then we will go for Depo-Provera injection. Is this point clear to everyone?
Yes.
If there's any confusion, then you people can ask. So we are done with two scenarios: contraception in young patients who are less than 20 years of age. In patients who are less than 20 years of age, UKMEC1 contraceptions are who will tell me you can make one contraception in patient who are less than 20 years of age?
Next planet.
No, they
Next
are
planet.
COCP and POP.
Okay, so there you can make one in
Yeah,
patients who are less than 20 years of age. Now,
yeah.
if the patient is less than 20 years of age and he is taking enzyme inducers, then these three drugs that are UKMEC1, they cannot be used if the patient is taking enzyme inducers. Then the only option that we are left with is IUS. You can make two drugs, IUS or deep-over injection. If this young patient is taking enzyme inducers, or he is a known case of epilepsy and he is taking carbamazepine, phenytoin, or phenobarbital, so in this situation, Nexplanon or COCP or POP, they cannot be used because their efficacy is reduced. So we will go for a UKMEC2 drugs, which are IUS and depo-provera injection. Now, if the patient is presented to us with heavy menstrual period, because remember that IUS is a choice of contraception if the patient is having heavy menstrual bleeds, or if the patient is having small fibroids which are not distorting the uterine cavity. The contraceptive of choice is IUS. If the patient is having heavy menstrual bleed and or the patient is having small fibroids which are not distorting the uterine cavity, then we'll go for IUS. Otherwise, we'll go for depo-provera injection. Now, some more contraception clinchers. As I told you that IUS or Mirena, IUS is also called Mirena. It is the contraceptive of choice or first line contraception in patients who are having menorrhagia, dysmenorrhea, or fibroids that are not distorting the uterine cavity. And in women who are less than 20 years of age, COCP, POP, and implants are the first line, and not IUD or IUS, unless the patient is taking enzyme inducers such as carbamazepine, phenytoin, or phenobarbital. Now, what contraceptive methods can be used in emergency condition? So if someone had unprotected sex and wants contraception, or she is looking for emergency contraception, then you have different options. If she is presented to you with within 72 hours or within 3 days of unprotected sex, then the option that we have is Levonil pill. So Levonil pill is an emergency contraception that can be used within 3 days of unprotected sex. What if the patient present to you within 5 days or after 3 days or within 120 hours? Then we have two options to use as an emergency contraception, and they are IUD, intrauterine copper device, IUCD, or LA1 pill. So after unprotected sex, if the patient present within 3 days, then Levonil pill will be our option. And if the patient present within 5 days, then IUCD or LA1 pill will be our option. LA1 pill will sometime be written in Plab1 exam as ulipristal acetate. The other name for LA1 pill is it contains ulipristal acetate. after unprotected sex, if the patient presents within 3 days, then Levonorgestrel pill, and if she presents within 5 days, then Ella1 pill or ulipristal acetate or IUCD can also be used as an emergency contraception. Now, sometimes in the exam, they ask that which contraceptive method reduces the risk of cervical cancer. Remember that cervical cancer can be caused by HPV virus. So barrier method of contraception such as condoms, because they can reduce the risk of sexually transmitted infection. So that's why condoms can reduce the risk of cervical cancer as well. So if they ask you about the contraceptive method that reduces the risk of cervical cancer, then your answer will be condoms. So this was all about